Hello everybody, my name is Matt Moreau and I will be discussing lab testing as it applies to sports medicine. When looking at what a normal result is for a patient, we're seeing if the result falls within a normal reference interval or reference range. The reference interval or range will be dependent or will be unique to the test that was performed. And it's very dependent on the population in which it was derived from. Our patient may have a different normal based on their race, age, gender, or other factors like whether they have fasted or not prior to having the test administered. For instance, a male may have a different normal range than a female. A Hispanic person may have a different normal range than a Caucasian person. So it's important to understand these factors and what role they will play in determining if our patient has a normal or abnormal test. When we're looking at how accurate a given test is, just like any other special test in athletic training, we're looking at sensitivity versus specificity. So does a positive test correctly identify the disease, or does a negative test correctly rule out the disease? We also look at positive and negative predictive value, which is influenced by both the sensitivity or specificity of the test, but as well as the prevalence of the disease. So we're looking at the percentage of the people with a positive test that actually have it, or those with a negative test that don't have the disease. And finally, there will be cutoffs for certain tests to determine if it's abnormal or not. And really, these are determined by what's the goal of the test. Is it disease detection or disease exclusion? If it's detection, it's going to weigh a little more heavily on sensitivity. And if it's exclusion, it's going to weigh a little more heavily on specificity, as basically no test has 100% sensitivity and specificity. So we also need to understand if the disease that we are concerned about has more than one test to determine if the patient has that disease. If there's more than one test available, then the clinician has to ask, does one positive test indicate that a patient has that disease? Typically, the answer is going to be no, we can't confirm that. So what we would do is, if the first test is positive, we can make the diagnosis. However, we want to run a second or third test to confirm that the patient actually does have that diagnosis. An example of this would be in HIV testing, where there's multiple tests. One of them is very cheap and easy to administer, but it has a higher false positive rate. So if the person tests positive with the first test, you want to run the second, more expensive, more accurate test to confirm they actually have HIV. It's also important to note that for some lab tests, we may need to establish a trend. An example of this would be anemia. If somebody comes in and has a test run and it shows that they're anemic, one day, we don't know if maybe it was a bad time of the day, or were they doing something prior that maybe lowered the levels in their blood. So we want to develop a trend over a period of time. If they continue to come back and they are anemic in their results, then maybe a diagnosis can be made at that time. We also want to try to attribute all abnormal results to one single cause, as most of the patients that we work with as athletic trainers are under the age of 60. So only after exhausting all options do you consider that a second possible cause may be affecting the abnormal results of tests. Finally, in conclusion, we need to remember a few things. Published normal results may not be representative of all populations, so our patient may not fall in to the population which was studied. Therefore, we need to understand that our patient's normal might not be the same. It's important to understand the goal of administering the test and the accuracy of those tests. So, do we need to administer a second test to confirm the diagnosis or to confirm the exclusion? And don't jump to definitive conclusions after just one suspect test. We may need to administer more tests and look more deeply into the situation before confirming to the patient that they have this diagnosis. Here are my references.